Ever pondered what happens when the heart, that tireless engine in your chest, stumbles and falters? What if someone around you, a loved one, a friend, or even a stranger, suddenly clutches their chest in pain, gasping for breath? Heart attacks, my dear listeners, are silent warriors. They strike unexpectedly, leaving little time for action. But fear not, because today we're going to unravel the steps of first aid for a heart attack in a clear, step-by-step manner. First and foremost, recognize the signs. The individual may experience severe chest pain, discomfort in the arms, back, neck, jaw, or stomach, shortness of breath, cold sweat, nausea, or lightheadedness. These are the red flags, the silent alarms that demand immediate attention. Once you've identified these symptoms, don't delay. Dial your local emergency number right away. In many countries, this is 911. While waiting for medical help, ensure that the person is in a comfortable position, preferably sitting down and leaning against a wall or the back of a chair. Next, if the person is conscious and not allergic, offer them an aspirin. It's a common household medication, but in such dire circumstances, it can be a lifesaver. Aspirin helps to thin the blood and restore some blood flow to the heart. Make sure the person chews it, as this allows for quicker absorption. If the person becomes unconscious, it's time to start chest compressions. Place the heel of your hand on the center of the person's chest. Put your other hand on top, interlocking your fingers. Push hard and fast, about 2 compressions per second, and don't be afraid to press down. You're trying to manually pump blood through their heart. Remember, while doing this, it's crucial to keep your arms straight and your shoulders directly above your hands to ensure effective compressions. If possible, switch with another person every 2 minutes to avoid fatigue. Now, if there's an automated external defibrillator or AED available, use it. AEDs are designed to be used by anyone regardless of medical training. Simply follow the instructions provided by the device itself. And there you have it. From recognizing the signs to dialing for help, from administering aspirin to performing chest compressions, these are the key steps to offering first aid to a heart attack victim. Remember, time is of the essence. The sooner you act, the greater the chances of survival. So keep these steps at your fingertips, because you never know when you might need to use them. A heart attack doesn't knock politely on the door, it barges in and takes over. But with the right knowledge, you can fight back. You can save a life. Just to recap, remember the key steps. Recognize the signs, dial for help, make the person comfortable, administer aspirin if possible, perform chest compressions if they become unconscious, and use an AED if available. Knowledge is power, and in this case, it's the power to save a life. So, arm yourself with these first aid steps and stand ready to combat the silent warrior that is a heart attack.